For you, it might be, hanging out with your girlfriends and going to happy hour. I'm an introvert, and I like quiet time. My days off when my husband's at work and I don't have to wake up at 5 o'clock in the morning. I get up with my cup of coffee and, I listen to podcasts or I play a game on my phone for a few hours. Like I really do. And so when I look kind of into this week at my schedule and I see like I'm not going to have one of those days. Like I can see like, either husband's going to stay home for, all the women know if there's somebody in the house, you are going to be taking care of them. I don't care how independent they think they are. Or, when I have meetings or, doctor's appointments or, something to do with the nonprofit or whatever, I have to make sure I plan time.
Welcome to the Let's Get Real, a candid conversation series about leadership, impact, and what it really takes to show up with purpose and authenticity. Today's conversation is entitled Rooted and Rising: How Community Fuels Confidence, Clarity, and Career Growth. Our guest is a powerful voice in medicine and mentorship, Dr. Shafonya Turner, a board-certified anesthesiologist, speaker, and wellness advocate. So welcome, Dr. Turner. Thank you so much for joining us on the Let's Get Real Candid Conversation.
Thanks for having me and inviting me and thinking if my work is important enough to talk about here in your great platform.
I want to start out by asking, how did your clinical journey evolve into teaching and working for a non-for-profit?
How I kind of evolved from, being a kind of a kid thinking I want to be a doctor to being a teacher and now uh, mostly a health literacy advocate. It started with, I always liked science. That was, a thing that came easy to me. And I, I tell a story often. I saw a story when I was probably 14 years old. I'm from North Carolina, from the South. And there was a story in a small paper. It's probably like a black, little tiny black periodical. It was about this woman in conflict battle, and she was an OBGYN. And, I probably hadn't seen a black doctor at that point, but seeing a black woman physician, like, oh, wow, that's something that you can do. Because up until that point, my dentist and all my pediatricians were all white men. And so that kind of lit the fire. And then my mom, little did I know, when she was, before she had me, she wanted to be a neurosurgeon. So she was going to join the Air Force and, go and get, the government to pay for her to go to school, but she had me. So, I think a lot of us know that we are our parents' mirrors. They see themselves in us. So here we go. And I went to Hampton University for undergrad, lots of wonderful blackness and education and competence and that kind of thing. And I met a gentleman by the name of Larry Keith during my junior year. And he was the director of this program at UNT Chapel Hill called MED. And it set students up who maybe came from underprivileged backgrounds, who didn't have access to the same education or educational opportunities, who were interested in medicine. And, bring them in, get them exposed to kind of a mini med school scenario. And, if you perform well, you get the opportunity to get a letter of recommendation and that kind of thing. So I did the MED program after meeting him, did well in the program, and here we go. I went to Chapel Hill for undergrad. And coming out of Hampton, HBCU, and then going to UNC Chapel Hill, which is an anchor school in the North Carolina system, but it's also a predominantly white institution. That was a culture shock for me. And so I saw the difference in exposure between a lot of the colleagues who look like me versus, some of the other students. And not to say that it's you know, congruent all around. All the white students didn't have access to information and all the black students weren't, completely, novice and unaware. But there was definitely an imbalance there. So I always liked science. I always liked teaching. And so when I went to UNC, I got the opportunity to teach young students who wanted to go into medicine because then I became the TA for the MED program that I had done. And just kind of being that big sister and kind of seeing myself in them, it further ignited. Like I knew I was going to stay in teaching some type of way. So I went into anesthesia, chose that as my specialty, and then joined the University of Maryland here in Baltimore on faculty there. So I walked right out of residency and became a teacher. And off and on, I've stayed with the University of Maryland for over 15 years. I left and went and did private practice for a while. But I always, when I talk to family, when I talk to friends about things that are happening in their health, I'm always like, call me, we can talk about this. And more than anything, it's important that um, people understand that like you have a lot more power in your healthcare journey than I think people appreciate. I think most of us just kind of come and sit in the doctor's office and we just wait for someone to tell us what to do. But just like in school, if you don't understand, what the teacher's saying, raise your hand and ask a question. But it also behooves you before you go into class to, read the book and to be familiar with the information so that when they do start talking to you, you have some foundation to apply this new information to. So that's the um, I guess the vantage point that I want people to take when it comes to their health care. That you're not just like this white sheet of paper that a doctor just decides to write a diagnosis on. You come with a history. You come with ideas. You come with things that are important to you that aren't. And so just like when Mr. Keith told me about this program that I never knew anything about, but then I went into it with a little bit more information. I was successful in MED because I had looked up what MED was about, and because I had MED, I had a little bit of medical school. So when I actually did start med school, I had already seen some of that information before, so it made it a little bit easier to digest. And so the same thing with what I do with my nonprofit. It Here's a little bit of information about diabetes. So when you go into the doctor's office and they want to prescribe you a medication, you now have some information to understand it, not be scared of it, and engage in it and help make the plan, um, so that the process, is more likely to be successful. And what success is being healthier, or and not being sick. But those are two different things.
Thank you, Dr. Turner. I think that intro is exactly why I wanted you to be on this on my series, because I think what you bring is so many things, specifically around health in communities that are, that maybe not have access to all the things. And we've had a conversation, even me as a nurse, in terms of my own health, as educated as I am about and understand and know the importance of certain things, there is a mistrust in certain communities. And so I think when you enter into a healthcare space with knowledge about whatever it is going on, it does the conversation and the dialogue is very different. You're not just taking in the information, it becomes a conversation back and forth, more of a relationship versus a dictatorship in some ways when you go in and not knowing. And so the only way for us to shift and change healthcare, and I can speak to the Black community, is for us to be aware and knowledgeable about ourselves and the things that are impacting us, and bringing and sharing that honestly with our healthcare professionals that we're interacting with. And so I think the more we do that, the better outcomes we'll have as a community. So thank you for that. So, what fuels your passion for education and empowerment?
I think, like I said, it's like when you tell somebody something or give somebody some information they didn't know, and like their eyes kind of get big, and then you watch them take that whatever that little nugget is that you gave, and they grow it into something. Is there's no true altruism, right? Like, you can't. I don't think it's possible to do anything for anyone and you don't get anything back from it. So what I get back from it is like, is it a little bit of pride, or what have you, just to feel like I contributed something. So I
Mm.
think that's a big part of it, feeling like I contributed. I think we all do at the end of our lives. Like, what's your legacy? Um, and I may not ever really see all the moments that I said something, or I led somebody to like read this website or talk to this doctor or check out this whatever web page or something, and what it led to after that. But I know that you can't keep your wealth, right? You hold it all. What is it, the parable of the talents or whatever? You can't just bury it and not use it. And so whatever you've been given, you're meant to share it. And because you die, you can't take any of it with you, whether it's your knowledge or your money or your degrees. You just dead in the ground. So like, the way your legacy lives, the way you live on is by giving out your stuff. And that, it sounds kind of selfish, and when you break it all down, like it's about me and making me feel better. But me feeling better is helping you. So hey, why not? I accept
Yeah.
it.
I love that. I think you said something that I feel all the time, but I always say, I have all these feelings and I don't know the words or I don't know how to align it. I think to your point about when you give, you get something back. And I feel that every single time. And again, I think however, whatever it takes for you to step into the space to give back, whether you're going to benefit or you're benefiting, whatever the driver is, I think in the end, it's still, we're doing good and for the greater good, right? Like it's for the
Yeah.
greater good.
And
Yeah.
make it like
Yeah.
the community is better. If it's teaching a class and now your nurses are better, like with your hair initiative or whatever, you taught this class, but now all these babies, or you create this initiative, and now all these babies, um their hair is going to be better taken care of, so they're going to feel better about themselves, and then they're going to get better when you feel better about how you look, or and someone caring about you. You get better. Those people who don't feel like there's anyone, they don't have an advocate, they don't have a family, they don't have a connection. Those It's hard to take care of those folks, because doing it by yourself, and we've all had those moments where you feel alone. Um, there's it's like, why? So why even get better? And I believe in energy and vibration and all that stuff. Whatever word you want to use. But if you don't feel connected to anything, and nothing is connected to you, so that the energy of the community pours back into you, right?
Absolutely.
You don't get any better. You're sitting over here by yourself.
Yeah.
There's nothing um feeding you.
Right. Right. So, what does leadership look like to you beyond the bedside?
I say to my husband all the time, like, leadership is not actually about the thing that you're actually doing. It's picking the right people to join you in doing it, and making sure that they have the tools that they need to be successful. That's what, like, we're searching for a chairman in our department right now. And one of my colleagues is actually the interim chair. He's like, I had no idea that this position is really about, like, it's money and finance, right? And so he has to, make sure that the department is running, so that the hospital continues to have faith in us and continue to support us and that kind of thing, which means that he has to pick the right doctors. He has to pick the right, folks to go to this committee or that committee, the folks who lead divisions. Um, so that's what leadership is outside of the bedside, is um, supporting other people, supporting you.
Mhm, mhm. Yeah, absolutely. Supporting and ensuring, to your point. I feel like, um, to me, I agree with you totally in terms of leadership outside the bedside. I think it's also advocating for the greater good and all of those things, and putting, like you said, putting the right people in place to get the outcomes that you need eventually as well. Yeah. How do you balance the high demands of your role as an anesthesiologist and then also giving back to your community?
Ooh, balance is a terrible word, um, because you think that one side of the equation is going to equal the other side,
Yeah,
and then
everybody uses that word. I mean, that's the word. It's like what is it called? The trendy word balance. Yeah, I don't like it either. I just asked the question.
oh, stop, stop. There is a ditty. There's I Oh God, what is it? I think you make it. I hate to say it like this. You make it moment to moment. Um, and whatever. So okay, this is my thing. I'm an introvert. Um, and I like quiet time. So, like, my days off when my husband's at work and I don't have to wake up at 5 o'clock in the morning. I get up with my cup of coffee, and I listen to podcasts, or I play a game on my phone for a few hours. Like, I really do. And so when I look kind of into this week at my schedule, and I see, like, I'm not gonna have one of those days. Like, I can see, like, either husband's gonna stay home, so all the women know, if there's somebody in the house, you are going to be taking care of them. I don't care how independent they think they are.
Mm,
Or when I have meetings, or doctor's appointments, or something to do with the nonprofit or whatever, um I have to make sure I plan time. So okay, maybe it's not this week, but like on Monday 2 weeks from now, that morning, I am not scheduling anything. Even if I need to go get my nails done, I'm not going to go do it. um, so planning for whatever that recovery exercise is for you. Like I said, for me, it's quiet and podcast and reading. For you, it might be, hanging out with your girlfriends and going to happy hour. Um, who knows, running, exercise, great things to do in your off time. But I don't think there's balance. I just think there has to be intention about finding and creating that. You have to create that space. It doesn't just come
It
anymore.
just I so agree. I don't like the word balance either. I talk about this all the time, and I think the other thing I've learned is over time it evolves in terms of what it looks like, whatever my body needs, right? So if it's maybe I do need, to your point, to stay in bed a few more hours and I don't know, surf the web, or maybe I need to go do some retail therapy, which is my fave, or
You and my
maybe I
mom.
need to go I need to go sit out and get some sun. And that's something I do as well. So I think, to your point, it is all about intention and making it, whatever you need in the moment and being flexible with that. But there's no balance. I don't believe in
Yeah.
balance.
And
No.
saying no.
Yeah.
You can say no to things. And, you know, someone wants you to speak at something, someone wants you to help out on a committee or a program. You could absolutely say no. Or you can, I'll take this piece, this, line item here, that dot. I'll make the Evite or something like that, but I'm not going to manage the RSVP. Like
Right. Right.
you can whittle it down.
Boundaries. Yeah, absolute setting boundaries. I think you have to do that not just professionally and then all the other things that you might be involved in, but also for family, right? Like I know for me, I have to say, not doing it. Sorry, not today. Yeah, absolutely. How do you mentor students and early career professionals?
Um, I tell them the first thing I always say is it's okay to change your mind. Because you know what I know and what I've been paying attention to, especially now, like with the changing, it's not really changing. It's just much more kind of in your face. But the changing like political landscape and social landscape and things like that is that like the education system, the way that it is now, is made to make workers. And so the bell ringing, that's like, that's in a factory, or this time for lunch, and lunch starts here and stops here, and then you go back to work. Um, and so I think like we don't know it, but we're participating in like some of the lack of creativity that people have about how they can make their lives and how they can create their lives. It's like, no, I'm supposed to start work at this time, and I'm supposed to get off at this time, and I'm supposed to eat dinner at this time and go to work and da, da, da. And even how you plan life, you go to college and then you find a husband and then you get married and you have kids, and you why is everything so prescribed? And so the first thing I say is you can change your mind. If you decide, like I said, at 14, I wanted to be a doctor. I don't know if I knew or really accepted that I could say no to that thing. I didn't, because I didn't have anything else I wanted to do except for possibly be a teacher. But if you go into something, you start a program, you go into undergrad, and gone into this thing for a year, and you realize like science is not your jam. Like I'm taking these biochem classes and statistics, and it's not for me. But that literature course I took, or that you know Black history course, or social activism, um, committee that I joined, like that's giving me fire.
Mm.
Consider that. I'm not saying completely drop the first thing, but you can spend some time in other places. Um, so yeah, that's the first thing. You can change your mind. Number two, you're going to fail. You're gonna fail somewhere. Is it whether it's a test or an interview? Um, you're gonna fail. Failure is just an opportunity to learn something. You just learn it a harder way. But I think most adults will say that the biggest, best lessons that you ever learned, you learned out of your failures. Um, Ask your parents when you talk about young people, right? Ask your parents or whoever is like the older mentor in your life about their failures and how they got through them. One of the first things I said to my husband when our first date, he has two sons, not by me, previous relationships. And I said, the best thing you can ever do for your children is let them see you fail. Let them see you at whatever it is. Let them see you fall and get back up. Because I think a lot of our kids today, because everybody gets the gold star and everybody gets the light, so that when you don't, like you and I were talking about, you get that funky, crazy comment on social media, you have no way of navigating um, negativity or failure. You feel like that is your identity now. Like you are trash because um, someone didn't like the thing that you did. You get back up and keep going, try something again, or don't worry about it then and find somebody who does like the thing that you did. So, yeah, change your mind and you can fail. Those are the two biggest things. And then, life, life's always stuff happens. Um, but unless you're dead, you get another chance.
I love that. Those are great tips for anyone thinking about mentoring or looking for a mentor to look for in a mentor, like characteristics or strategies. Um, what advice would you give to a woman in medicine who feels called to do more?
Well, find your tribe. Um, um, yeah, that medicine is very conservative. So, think white men with crispy white shirts and the perfect pen in the pocket and the glasses that are, perfectly tailored. It's still that, even though more than 50% of the people going into medical school now are women. But the culture of it is still conservative white men. Um, so you got to find your tribe, and you find your mentors too. So your tribe are your people that you tell your stories to. They give you their stories, and you guys, you take the pieces that work for you and you apply them to your life. But your mentors, those are going to be your guides and also accountability partners, right? Um, and they're going to be people who see it in a different perspective. So I tell anybody that I talk to, young or old, you should have a mentor that looks like you and a mentor that doesn't. So if you're a woman, have a woman. If you're black, well, one of them be black. But me, one of my mentors is a tall, burly white man. Looks nothing like me. So his experience of this space is different than my experience. What he hears is different than what I hear. Not only like actually what's said to him, but the filter that he's hearing it through. Um, and um, And then when you're starting out early, the last thing I'll say is say yes to everything. So when you go into a new space as a new nurse or a new doctor, or even, when you're in school, if someone says, hey, do you want to help me out with this? Or we're starting this new initiative or this new program. Do you want to help? Say yes early, right? So that you get exposed to all these new different things and you figure out what things you like and what things you don't. You figure out leadership styles that you like and leadership styles that you don't. Because if you only always go to the things that you like, um, it's like the kid always eating, Pop Tart and Butterfinger, Well, maybe one day you might actually like green beans, but you never tried green beans.
Nobody likes green beans. Where are you?
You can have my green beans. Oh my gosh, don't tell me. You're a whole healthcare professional. Eat some fiber, y'all. We don't have enough fiber. That's why all these people in their 30s have like colon cancer, because they're not eating enough fiber. So yeah, those are the things. Mentorship and just kind of jump off the cliff at first and see what sticks. You know, throw some stuff at the wall. That's a better analogy. Throw stuff at the wall and see what sticks.
Love it. Love it. Dr. Turner, I want to thank you for coming on to Let's Get Real Candid Conversations and dropping all of those gems. I really do appreciate it.
Well, thank
How
you.
can our listeners get in touch with you if they're interested in connecting or learning more about what you do?
So I have a nonprofit. Like I said, health literacy is super important. Only about 12% of the American population has good, proficient health literacy. And we know that health literacy improves, healthcare spending. It obviously improves outcomes for the patient and it improves patient experience. So it's my nonprofit is called Caring the number four us. And you can find me at caring number four us.org. And there's a contact me little page on there, or my email address is the same thing, curing the number four us.health@gmail.com. Those are probably the two best ways to find me.
All right. Thank you. Thank you so much again, Dr. Turner, for joining us. I want to thank you all for listening, and I will see you, hear you, or you'll be listening to us on our very next Let's Get Real Candid Conversations. Thank you all so much.
Thanks for having me.